Let's talk about some hip hinging tips and tricks to help you get the most out of your hinging patterns. Now, I really like working hip hinges in more of a split stance because then it allows you to address what is happening on each side of your pelvis. Because what you might need on one side might be a little bit different of what you need on the other side. So first, let's talk about just a hip hinge pattern in general. So with this split stance position, we're going to have our left foot forward here and our right foot back just slightly. You want to really focus on hinging through this front hip. This is your primary focus here. So as you're here, you're making sure you're actually on that hip versus being shifted back or shifted off to the side. So really thinking that this back foot is a little bit just like a kickstand to help support you while you're on that leg. You're going to make sure that your front knee stays soft and over your midfoot throughout the movement, to really making sure that you're getting this opening and lengthening through your glutes and through your proximal hamstring instead of through your distal hamstring. And I'll show you what that difference looks like in just a moment. The other thing we're paying attention to is your starting position. So if you're already starting kind of tip forward, flared forward in your ribs, tucked under or shifted back, then you're not really set up in a good position to then lengthen from. So first we're going to think about kind of being nice and tall and making sure, like I mentioned, that you're centered over that front leg. And we're going to think about making sure that we have our abs connected back here so we're in a nice stacked position. You might have to start off with kind of arms reaching forward and thinking about inhaling back into your rib cage and then exhaling your ribs back, maybe giving a little lift in those lower abs. If you're having a hard time with that, then you might need to break it down and work on some other exercises in our other content to help with that stack. But just kind of giving a little bit of a nod of that connection of, okay, as best you can without forcing it, getting that rib cage stacked over your hips, okay? If you're doing this repositioning by clenching your glutes, now your glutes aren't free to actually lengthen and move like we want. So this is why we're trying to get it to come from your abs instead. Now, as you go to hinge, you're gonna think butt back, chest down, maintaining the stack of rib cage lined up over your hips while you're getting the length through this front leg glute. You're thinking about that glute getting bigger, and you're thinking about sitting back into those hips. And then you're going to go to push the ground away and kind of pull it back to help you return to that starting position. Now, what can happen is that as you go to sit back, if you don't have the ability to lengthen here, you might drop down, you might tuck under, you might tip forward, okay? So really thinking that we're trying to make sure that this is a horizontal movement back and really getting these hips to sit back into it. Now, to make sure that you're not just lengthening from your distal hamstring, we're keeping this knee over the midfoot. So you're making sure as you go to sit back that your knee isn't shifting back with you. So you might almost have to think of someone holding your knee here while you reach your hips in the opposite direction. To get more lengthening through the underneath side of your pelvis, as you go to come down and to help you not go into a posterior tilt where your pelvis tucks under, you might almost have to think about lifting your sit bones up and feeling yourself and your pelvis tip up and over your femur as you come down. That's going to help get not only the length in those glutes, but also in that proximal hamstring. And whatever you lengthen is whatever is loaded to help you come out of it. Now, to come out of it, you're making sure that you're not lifting with your back, but really thinking about that rooting down, finding those glutes and proximal hamstring to help bring you back up. So that's the general pattern there. You should be feeling the work happening in the front leg, glute, and hamstring, okay? Now, sometimes that's all easier said than done. So let's talk about some different tips and tricks that can help you with that positioning. Sometimes our body needs a little bit more support in order for that lengthening to happen. If a muscle isn't strong enough to eccentrically lengthen or doesn't feel supported enough, then it's going to stay tight. So this is where we can use a chair. So as I'm here, I want to make sure that I don't get excited about the chair and already kind of come down here, but think about, okay, can I start my hinge? And then as I get here, my chair is available to me. I can use it to help kind of unload my upper body. And then I can even help with the press a little bit to come back up. Sometimes just doing a few reps of that where you're just patterning and helping that tissue feel nice and supported can help you then step away from it and not use it as much. Now, if you're feeling a lot of it in your hamstrings or behind your knee or even in your calf, then this is where using a book can help with that. So with this, you're going to put a 1-inch book underneath your front heel, okay? So as we're here, this is gonna help us stay a little bit more forward and gives us then a place to sit back into. It can also help with this idea of lifting kind of up and over to help lengthen the underneath side of those hips. So as I'm here, my knee is soft. Now it might feel easier for me to sit back into those glutes, keeping that knee over that midfoot, and then I can really feel grounded through that heel to come back up. Really connecting with that heel without losing the base of that big toe can help you find more glutes and hamstrings to come back up with it. And with any of these additions that we're having here, it's all about making your hinge easier. If it just feels like one more thing to think about and doesn't help you just flow into the movement, then that's not the addition for you. Now, we also want to look at kind of frontal plane control. So as we're here, we're thinking about that we're just trying to stay in the sagittal plane, which means we're limiting ourselves of not rotating in the transverse plane or dropping in that frontal plane, okay? So I almost think of it as like we're trying to do an isometric to kind of hold us in place in the frontal and transverse plane to help us then move through the sagittal plane. That's gonna help sit us straight back and really open up through the backside of those hips, and then help us use more of that glute max as the primary hip extender and the muscle that we want to be our primary, glute muscle here, instead of going into external rotation and using our deep hip rotators. So as you go into a hinge, if you notice that as you come down, your back leg hip stays lifted up, then this is going to be a case where we can use more adductors to help pull the pelvis down and open up the backside of the hips. When this back leg stays lifted up, you can think of it as someone keeping this back glute squeezed in. So we're going to use the adductors to help with this opening up and rotate us down. How we're going to do that is with a band. So you're going to put the band to the inside of your knee so you have some tension, so you can feel how the band wants to pull you out. So then you have to hug in. You want to make sure that it's enough tension that you don't just collapse in, because then you're just driving the movement from the femur, versus if the band is here and my knee stays steady, then you're going to drive the movement up at the pelvis and actually get that relative motion in the pelvis. So I'm here, I'm hugged in, and then as I come down, using this hug in should help my hips stay nice and level. To help encourage a little bit more, you might have to feel like you have to reach this back knee down or drop that hip down a little bit to help things stay level, and then making sure that you maintain that as you go to come back up to keep you in that sagittal plane. We don't want to come back up and turn away, because again, then you're using your deep hip rotators. On the same note, you can use your back leg glute to help with that steering of your pelvis and to give it a little bit more stability. So what this will look like is being here with this back leg, thinking about it pushing back, but without letting your knee straighten. So as I'm trying to push my right leg back, I'm going to feel my right glute and hamstring work. Because the ground can't move, what that is going to do is that it is going to, so as I push my right leg back, that's going to push and rotate my pelvis towards the left to help me sit back into my left glute. You're making sure that your femur didn't rotate with you. So that knee stays nice and set, and then I rotate down. Now I come down into it, and then I come back up, okay? So with that, you should feel that back leg glute, the front leg, maybe adductor, inner thigh a little bit, and then really opening up the glute on the front leg. The other benefit of that is that now you're working your glute in more of an extension pattern and positioning on this right leg when it's back, and then when it's forward, you're working it through more of a flexion to kind of neutral position. Now, on the flip side, if you go to hinge down, and as you go to hinge down, your back leg drops down and collapses, this is representing weakness in this right glute med, because your glute med helps keep your pelvis lifted and level. This can happen because of that weakness, or because maybe you're restricted in the backside, so then you try to move from somewhere else instead. So as I go to do this, I'm going to use the band to pull my knee in. So as I'm here, my knee is being pulled in, so I have to push it out. I'm making sure my knee doesn't turn all the way out towards the right. I'm making sure I stay grounded through the base of that big toe to help me find that glute med here and not go so far that we go into more external rotation or excessive external rotation and kick in deep hip rotators as well. We can also think about rooting down through the outside of that hip and thinking about using this glute med to pull my pelvis up, making sure you're not using your QL on this side to hike your left hip up, okay? So as I'm here, I'm rooted down through the outside, that knee is pushed out with that big toe grounded, and then I go to hinge down, sit back into that right glute, and then keep that as I go to come back up. It can be helpful with using that back leg to push to help you stay centered and stable, whether you're using the band on the outside or on the inside. You can also use the book or the chair, whatever combo you need to feel good and help you just kind of groove the pattern without having to think so hard. So hopefully you took away a tip or two that will help you in your hinges and feeling more of your glutes and your hamstrings and make your hips and pelvic floor happier.